Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Ganglion blockers. Ganglion blockers are actually of two types. We have simple ganglion blockers and we have complex ganglion blockers. Simple ganglion blockers are also called as competitive blockers. The simple ganglion blockers, mainly examples are, we have trimethophan, hexamethonium is a simple ganglion blocker, and we also have micamilamine is a simple ganglion blocker. Then we also have complex or non-competitive ganglion blocker. Complex or non-competitive ganglion blocker include guanidrel, guanethidine, beryllium, and debresoquin are the complex or non-competitive ganglion blockers. So first, mechanism of action of ganglion blockers. Ganglion blockers will as the name says, they block the ganglion. Which ganglia they block? They block the nicotinic receptors which are present in the ganglia. That too, these ganglia are present, they will block the nicotinic receptors which are mainly present at the postsynaptic junctions. Then simple blockers. If you see the simple blockers or competitive blockers include trimethophan, hexamethonium, and mecamilamine. So these simple blockers are actually well absorbed, whereas the complex blockers are actually not absorbed well because they are uh, quaternary amines. Then we have trimethophan. This trimethophan is shorter acting, and because it is shorter acting, so the half life of this trimethophan is around 1 hour is the half life for trimethophan. And this trimethophan is not just short acting, it is also rapidly acting drug. Side effects of ganglion blockers. The side effects of ganglion blockers are it can cause mydriasis, cycloplegia can occur. Actually, side effects of ganglion blockers are similar to the nicotinic effects. So, it can cause mydriasis, cycloplegia. It can result in cholinergic side effects like hypotension, bradycardia may be seen, and there is diarrhea. The patient might present with constipation or impotence, or he can even present with fluid retention also. So these are the main side effects of ganglion blockers.
thank you and thank you for watching.